I had a patient interaction earlier this week that led me to create this video because I wanted to dispel a myth about health-related anxiety. The patient had a bad vertigo spell several months ago. They ended up going to the ER, they got CT scans done of the brain, they did EKGs of the heart. They decided that the patient's life wasn't in danger, so they discharged the patient with a diagnosis of vertigo, told them to follow up with ENT, and then see what may have caused the vertigo. Vertigo is a very distressing symptom. It can be so bad that people develop quite a bit of anxiety about the next vertigo attack. And in the time that they were recovering from their vertigo spell, they ended up having a lot of chest palpitations, they were having lightheadedness, and it created a lot of fear about what else might be going on. And there was times where the patient felt like their chest symptoms were bad enough they went to the ER again to get evaluated. The scans were normal and they were discharged without any pathology going on in the heart. Time passes, the patient no longer has vertigo or disequilibrium, but the lightheadedness and some of the chest palpitation symptoms doesn't quite go away. And they start to investigate other causes of cardiovascular symptoms, which brings them down the path of looking up dysautonomia, and then they end up coming to the office to try to investigate if they have dysautonomia, if there's anything we can do about it. The patient has had upper cervical chiropractic in the past and it's made them feel better, so they wanted to see if upper cervical chiropractic could help them with this specific problem. And sure enough, after a couple of visits, they were feeling better after getting a couple of adjustments. Now, this might sound like a success story, but what happened was that this patient continued to come in even though I told them that they didn't really need any more upper cervical chiropractic visits because their atlas alignment was holding very well and that they could go longer and longer time between visits, but they insisted on coming in every single week. Each week, the patient would come in and talk about a new body sensation or a new issue or a new complaint where they said it wasn't as bad as their initial heart palpitations and lightheadedness went, but they were really concerned about a new sensation and that something could be really wrong with their cardiovascular system and their brain and how it might be related to their atlas misalignment. This is when we had to broach the topic of the patient potentially having a health-related anxiety disorder related to the trauma from the initial vertigo spell and all of the emergency room visits that were associated with that. But the response to that was that the person didn't think that they could possibly have a health-related anxiety disorder or an anxiety disorder at all because they were known for having this mental toughness. But being mentally strong doesn't necessarily protect you from health-related anxiety. We've had people that have gone to war, have passed through Navy SEAL camps, and even people that are still actively risking their lives to do special operations have health-related anxiety even though every other aspect of their life is not anxious at all. Health-related anxiety is especially common whenever things are affecting your brain or your cardiovascular system or your ability to breathe. And what happens is people will notice an abnormal sensation, then they notice that even though it's nothing that is actually hurting them, but it feels unpleasant because it's new, and that leads their mind to start drifting into things like what caused this to happen, and you start to research on the internet, and all these different internet articles start to make you feel anxious about the fact that it could be cancer, early cardiovascular disease, some type of brain disorder, and that makes you start to monitor your internal body sensations all the time. And when people are monitoring their internal body sensations, even normal sensations that are happening inside of the body is something that you might have discarded before in the past because it wasn't harming you, but because you had this recent health episode, you start to think that this might be a new sensation that's associated with this new health condition that you've just been diagnosed with. Listen, anxiety may not necessarily be the cause of why you felt sick or why you felt ill, but if you don't address it, it may be a factor in why you're not getting better from the condition that you're experiencing. Health-related anxiety can be like a magnifying glass that prevents your brain from doing anything besides focusing on your internal body, and that's not really a healthy way to be because most of the things that are happening in your body should be on autopilot. We shouldn't really be thinking about what's going on inside of our bodies all the time. I never want to dismiss someone's physical suffering as being attributed exclusively to anxiety, but the truth of the matter is if we ignore our mental health, then we ignore an important lever that we need to pull in order to help someone make a full, complete recovery. And treating anxiety doesn't have to be a one-size-fits-all approach. There are lots of ways that people can address anxiety, including seeing a therapist, being on anti-anxiety medications, having good social support, getting neurofeedback, or even just going out and going for a run and getting an escape through something like a sport or a physical activity.